Good afternoon, everyone. My name is Leslie Dock, and I'm the chair of Protect Our Care. On Friday, the House will vote on the Inflation Reduction Act of 2022, historic legislation that was decades in the making. This bill will do many things. It will take meaningful steps, critical steps, to battle climate change, and it will reduce our deficit. But the provisions that will have the most impact on the most lives, most immediately, are the provisions that have to do with healthcare. There are two incredibly important pillars of this bill. One is giving Medicare the power to negotiate for lower drug prices, and the other are provisions to lower the cost of healthcare insurance for millions of Americans. Neither of these provisions would be in the bill that the House is voting on Friday if it wasn't for the leadership of the two members of Congress joining us today. Congresswoman Lauren Underwood from Illinois was the author, architect, and lead champion of the provision to lower healthcare insurance premiums. Over 13 million people will benefit from that provision, including our storyteller, who I'll introduce in a minute. The provision to give Medicare the power to negotiate for lower drug prices for 50 million Medicare beneficiaries would not be in the bill if it wasn't for the tireless work of Congressman Peter Welch from Vermont. Americans owe them both a debt of gratitude. As I mentioned, we were also joined by Krista Ostenso from Wisconsin. Krista has a small business. She purchases her family's coverage through the ACA and also works to pay her employees enough so they too can afford coverage on the marketplace. She will tell you why this provision, championed by Congresswoman Underwood and in the bill on Friday, is so important to her family and her employees. This legislation is desperately needed, particularly at a time when Americans are grappling with rising prices. The legislation is incredibly popular with the American people, no matter where they live or political party they support. And it's a victory over the special interests, particularly the large pharmaceutical companies who have spent over $140 million trying to defeat this bill. We all know how being sick takes over our lives. And imagine being sick without being able to afford the care you need and what that does to your life. But that is the reality for millions of Americans. That's why this bill will make a real difference in the lives of real people. People who work hard every day but can't afford the drugs they need to stay alive. People who work hard every day but can't afford to pay for health insurance and die way before they should because they aren't diagnosed in time. And now let me turn the microphone over to Representative Peter Welch.
Thank you very much. And I want to thank Protect Our Care for your tireless advocacy. And Leslie, thank you for hanging in there day in and day out and really helping educate the public and all of us about the possibility of what we could do to lower drug costs. And I also want to thank my colleague, Lauren Underwood, who's just been such a tremendous leader in Congress to make healthcare premiums affordable. You know, if you can't afford access to healthcare, you don't have access to healthcare. So Lauren, just thank you. And all of us in the caucus are so grateful to you for your leadership. The question of prescription drug prices is tied up with the cost of healthcare. You know, healthcare is about 20% of the gross domestic product, and the price increases have been relentless and endless. And the fastest growing pricing area in cost area in healthcare has been the increasing cost of pharmaceutical drugs. And we've had this situation in America where when Part D was passed, which then was a wonderful extension of healthcare benefits to seniors on Medicare, where with the passage of Part D, it finally recognized that pharmaceuticals, drugs, really had to be part of the package of delivering healthcare. As part of getting that passed, the pharmaceutical industry was successful in doing something that no other industry has ever done. They got a prohibition against the purchaser of medications, a bulk purchaser, from negotiating to get an ability to buy wholesale, or pardon me, to pay wholesale when they were buying wholesale. We had to pay retail. the so-called non-interference clause was a way in which pharma had the non-interference. They could set whatever price they wanted. And over the years, since Medicare Part D was passed, the pharmaceutical industry regrettably abused the incredible legal entitlement that they received, where they set whatever price the market would bear and pass the cost on to employers who are purchasing employee-sponsored healthcare. They passed it on to taxpayers in the Medicare program, and they passed those costs on to individuals who had to pay out of pocket. And it's been brutal. It's been brutal, brutal, brutal. And the tool that we have been fighting for, led by many, has been a very basic tool in capitalism, and that's negotiation. If you're buying 100 pills, you can negotiate to pay a lower price per pill than if you're buying 5. That's really what negotiation is about. And the pharmaceutical industry has been fighting this. You mentioned, Leslie, I don't know, not 185 million or whatever it was this time, but when you think about what the pharmaceutical industry has spent for the past 15 years that I've been in Congress, it's probably into the billion plus range. And why not? Because if they can continue to set whatever price they want, then, and we have to pay it, then they're going to fight to maintain that. So what's happened with this legislation is that the tool that we as a government, as taxpayers, and as citizens need, price negotiation, is on the verge of being enacted into law, hopefully with a vote in the House on Friday and a very soon to follow signature by President Biden. The immediate benefits of this are real. I mean, start with the fact that it's going to cap out-of-pocket costs for seniors at $2,000. That is tremendous. You know, some cancer drugs that folks need, you can't even begin to get in the door for $2,000. So it's going to give enormous security and cost relief to many of our seniors. We are going to see in Medicare that the pharmaceutical companies won't be able to increase the cost beyond the rate of inflation. And the pharmaceutical industry, that's one of the tactics they use. They get a patent, they set a price, they get what they want, and then they increase it year after year after year, even though there's been no research and there's already been a price set that provides a very handsome and very prompt return. We're going to have protection on diabetes. So many millions of Americans are so dependent on insulin, and it's going to be capped for Medicare beneficiaries at $35 a month. And my goodness, that is really fair. Insulin's been around for decades. There's been no new research or breakthroughs. It's an absolutely life-saving drug. And now it's going to be made affordable for the folks in the Medicare program. So this tool of price negotiation means that the government that represents the citizens of this entire country, whether they voted for Trump or they voted for Biden, is going to be able to act on behalf of consumers and taxpayers and employers to negotiate for fair and reasonable prices from the pharmaceutical industry. This is the beginning. This tool has finally broken the iron grip that pharma has had, that they've utilized with punitive pricing, that has so hurt our consumers, our taxpayers, and our employers. So the significance of this is twofold. One, we've got the tool we need, and it's the beginning. Don't underestimate the power of the slippery slope. We're going to see that this works. We're going to see the broad-based benefits that come from using negotiation, and we're going to be able to use it in a way that is going to protect consumers and taxpayers and employers without, as we're going to find out, harming innovation. And then secondly, this is going to bring immediate financial benefits to seniors, folks on Medicare with a $2,000 cap, folks on Medicare with a $35 cap on insulin per month. And then we're also going to see that this is going to extend the life of Medicare. It's going to lower costs to taxpayers. And all of us who've been advocates for this legislation are going to continue the effort to broaden this to more pharmaceuticals, to the private sector. And I believe we've got some wind at our back with the final passage and signature when it comes from President Biden. Thank you all very much.
Thank you, Congressman. When Congressman Underwood and I were speaking earlier, I was thanking her for all of the hard work she had done. And she broke out into a big smile and said, you know, I'll do it again. This is my life's work. And I know that from my knowledge of Lauren, how true that is. And in her short years in the Congress, she's already shown how much she can accomplish. So let me turn the mic over to her.
Well, thank you, Leslie. Good afternoon, everyone. Thank you all for joining us today. And thank you to Congressman Welch and our friends at Protect Our Care for your leadership in ensuring that every American has access to high quality, affordable health care. We're here today because we have a once in a generation opportunity to pass the Inflation Reduction Act and reduce healthcare costs for millions of Americans. Since my first day in Congress, I have been laser focused on making healthcare affordable and accessible for all. And that's why I introduced the Healthcare Affordability Act, which was included in the American Rescue Plan and has significantly lowered healthcare costs for families by expanding advanced premium tax credits. But this American Rescue Plan provision is set to expire at the end of this year. We cannot go back on the progress that we've made. Because of my bill, a record 14.5 million Americans have enrolled in coverage this year. Annual premium costs have lowered by an average of $2,400 per family per year for Affordable Care Act plans. And we've cut the uninsured rate in half to 8%, the lowest in our country's history. Not only do these tax credits lower out-of-pocket premium costs for families, but they're also instrumental tools in promoting equity. The uninsured rate for Black and Hispanic adults is disproportionately higher than white adults. But thanks to the American Rescue Plan, 75% of Black adults and 79% of Hispanic adults can find a plan for $50 or less per month. These coverage gains will help address disparities we see in a wide range of financial and health outcomes, from chronic disease to maternal mortality. The Inflation Reduction Act would continue these historic advances in affordability, coverage, and equity by extending these tax credits for an additional 3 years, making healthcare more affordable for 13 million Americans. If we don't act now to pass the Inflation Reduction Act and extend these savings, families will face sharp, unacceptable premium increases for their 2023 healthcare coverage. In my state of Illinois, without these tax credits, over 15,000 residents would become uninsured, and thousands more would face painful premium increases. Other state-based marketplaces have shared alarming projections about healthcare cost increases if we don't pass the Inflation Reduction Act. Fundamentally, healthcare is a human right, and we have a historic opportunity to make high-quality care more affordable and accessible. The Inflation Reduction Act does this while also reducing the deficit, lowering prescription drug costs for seniors, driving down inflation, and making the single largest climate investment in US history. Too many Americans go without health coverage because of the cost. My Healthcare Affordability Act in the Inflation Reduction Act will help Americans secure coverage, leading to better health outcomes and providing relief to their household budgets. On Friday, I plan to put people over politics and vote for the Inflation Reduction Act. Thank you.
Thank you, Congresswoman. And I'm glad you raised the equity question, because we talk about numbers and sometimes we forget who those numbers really cover. And unfortunately, as we see now, brought even more to light by the pandemic and what it caused people to realize is that Black and brown and people of low income are always on the bottom of the scale when it comes to access to healthcare, and they pay the price with their own lives. And so this bill will disproportionately help people of low income, disproportionately help people of color. And that's a critical promise that we need to deliver for them, both in terms of health insurance and the cost of drugs. So thank you for that. I just want to go through some of these numbers because people, the provisions can sometimes seem complicated, but there will be 80 drugs negotiated by the end of the first chunk of work by HHS. That's 80 of the most expensive, most popular, and drugs that most dramatically impact patients' bottom lines. The inflation cap, which says that drug companies can no longer just raise prices just because they can, way over inflation, starts kicking in this year. The provisions Lauren talked about, Congressman Underwood talked about, take effect at the end of this year. Actually, people will experience them when they sign up on November 1st to extend their health care. The caps will begin to take effect next year and the year after. At least somewhere around 2 million Americans will benefit from those, and the list goes on. So these are meaningful, but they also, people will see them. I want to turn this now over to Chris Otenso. She's a small business owner, owns an optometry clinic in Ladysmith, Wisconsin, and she gets her health insurance on the ACA exchange. And she also works with her employees to be sure they do the same. And I think this is a little bit of an untold story about the Affordable Care Act, because it's a place where millions of small business people go to buy their insurance for themselves and, in a sense, for their employees. And without the ACA, that insurance would be unaffordable, both for the boss and for the workers in many, many places. And so Krista will tell us about why the work to continue to keep healthcare insurance costs low matters so much to our family and her colleagues. Thank you.
And thank you so much for including me in this important call. About 30 years ago, my husband, who had just graduated from optometry school, and I and my 1-year-old son, we moved up to the North Woods of Wisconsin because we had purchased an existing optometry clinic to operate up here. Within 5 years, we added 3 daughters to our team, and our business kept growing, fortunately. When the kids were finally heading out the door and I had some time to breathe, I started thinking a lot more about the struggles that my patients and other community members had been having for years, really, to afford the kind of healthcare that they needed so badly, and the effect that it was really having on the overall health of the community. I talked to a lot of people in my community about the issue, and it was so obvious that we all agreed that everyone should have affordable access to healthcare. And yet, year after year, our country was unable to try to create a plan for that. From a provider standpoint, being in a healthcare business, it was glaringly obvious that the insurance companies kept racking in huge profits, even though they never seemed to increase the reimbursements to my practice. From a health insurance consumer standpoint, we were always experiencing steady increases for my family of 6 at the time. We had 1 daughter with cancer. So of course we were super thankful when the ACA got rid of the pre-existing condition problem so that she would no longer be rejected and having to be bumped out of our family plan and go and purchase a different COBRA plan or something through the state. So that was nice, getting rid of that pre-existing condition thing, but we still saw the ever increasing, prices. Until in 2021, we were paying $1,979 a month as our premium for a policy where that was just for 2 people, and my husband and I each had a $6,000 deductible. So if you add that all up, it's like way more than 25% of my income. We were thrilled when the American Rescue Plan capped that, what any family is supposed to spend at 8.5%. At first, it brought my premium down to $276, which was later just adjusted up a little to $495, like a correction or a change in income or something. But we're still saving almost $18,000 per year on our premiums. This meant freedom to actually go to the doctor and spend our deductible. have access to the care we needed as we approach our retirement years. It also meant freedom to consider earlier retirement options, possible career changes, and it also allowed us to give substantial raises to our employees so that together with the subsidies, they could all finally access healthcare, which at that time, we had 2 employees that had no healthcare coverage at all, and they jumped on there and are really happy about that. For so many in my community, this can mean freedom to open a business, change jobs, and basically follow their dreams. I'm so grateful to Representative Underwood and Representative Welch and all of the great Democratic leaders in our Congress, and to Joe Biden for really just being persistent and keep working on this and working on this over the years. And now I'm so hopeful we're so close to knowing that these subsidies are not going to end and that they're actually going to be get pretty much guaranteed to us for the next 3 years. I want to encourage all middle income earners like me, business owners, gig economy workers, self-employed. Up here we have loggers and farmers. If you are not currently insured, please give yourself the freedom to access the care you need and follow your dreams, and plan to sign up during the upcoming ACA period and get yourself some health care.
Thank you, Krista. That's the story of the Affordable Care Act, and that's the story of the work that both representatives have been such a large part of. It's a law, as President Obama said, was woven into the fabric of American life. And yet, unfortunately, on the political side, we still had every Republican in the Senate vote against it. Republicans refused to cover insulin for people outside of Medicare. I'm sure that we'll see the same sad story in the House, and many still wanting to come back and repeal the Affordable Care Act. So we will make great progress on Friday, I am sure, but we should never forget also the risks that still exist to all that's been built. But thank you for sharing your story. Thank you for the commercial for the rest of your citizens in northern Wisconsin, which sounded a little bit like Vermont to me. In terms of professions. And with that, though, I think unless either Congressman Welch or Congresswoman Underwood have remarks, we'll turn it over to my colleague to take some questions from the press.
Sure thing. Thanks, Leslie. So if you're a reporter on the line, you can let us know you have a question by clicking the raise hand button at the bottom of the screen. You can also chat us a question or email it to us. So I'm just going to give it a minute to see who has questions. All right. The first question is going to be from Rachel Rubin from the Washington Post. You should be able to talk now, Rachel.
Hi, thanks for taking my question. I wanted to ask Congressman Welch and Congresswoman Underwood about what the message on the campaign trail will be in terms of this bill, particularly one, how you plan to message it to voters, and two, because some of the provisions, particularly the $2,000 out-of-pocket cap and allowing Medicare to negotiate drug prices, a fair bit of the provisions don't kick in months to years so they take a while to be implemented. So voters won't feel that effect. So do you mind talking a little bit about your messaging and whether messaging something that's not going to be implemented for a while is a challenge?
I'll start, Lauren, if it's okay. I think candor and clarity. The fact is that this is a tool, price negotiation, that's going to provide benefits, if not immediately. It will be providing them. And one of the most popular issues among Republican and Democratic respondents has been getting drug price negotiation. We got it. And I think the candor is, we got it. We didn't get everything we wanted. HR 3 was what I wanted. But I also think there's a message in effectiveness. We actually got this done, got it signed. We've got that tool that's going to be bringing these costs down. And we can be explicit about what's in the bill and when it starts and what the benefits are. And we can also lay out where we want to go. This is the beginning. It's not the end. But we have a beginning because we now have price negotiation. We now have $35 a month insulin for Medicare beneficiaries. We want to expand that to the private market. So I think our message is we got negotiation. It's going to bring savings. This is the beginning and we'll keep at it. Lauren?
The piece I would add are twofold. One is that my constituents, Peter Welch's constituents, and constituents of every elected Republican member of Congress is benefiting from this provision, which lowers their out-of-pocket premium costs. They're benefiting right now. And what we will have done on Friday was offered them a 3-year extension, meaning that their healthcare costs will remain affordable for the foreseeable future. Period. This is happening in real time in every congressional district across the country. And we are the ones that will singularly have extended the security of affordable healthcare coverage to the American people. The contrast piece with Republicans is one that has to be underscored, that they have constantly taken votes to deny affordable healthcare coverage, whether it's prescription drugs or premiums, to their constituents who have been clamoring for it. Meanwhile, House Democrats have stepped up and put people over politics.
Both of those extremely well said. And I think also constituents realize how hard it's been to get this done. And they understand, that this has been a long time coming, and that these two members and others in the Democratic House and Senate are the ones who got it over the line. And as Lauren said, there are many parts of this that start right away, start November 1st, 13 million Americans, $2,400 a family, the inflation rebate. So these are things, there's a lot that starts right away on this as well. Are there other questions?
Yeah, thanks, Rachel. So the next question is from Michael Jones at Super Creator. You should be able to talk now, Michael.
Thanks so much for taking my question. I have a question for the Congress members. Can you speak to how the persistence that Democrats demonstrated through this process that dates back to last year can be translated to other issues that haven't made it across the legislative finish line yet?
Well, Lauren, maybe you start this one. Go ahead.
But we don't give up. We are very clear that the American people are expecting action on a number of items. And I think that this string of legislative successes on everything from gun violence prevention to infrastructure, climate action to healthcare, today, the signing of the CHIPS and Science Act, tomorrow, the Honoring Our PACT Act. These are legislative victories that touch the lives of Americans in my community. I know in Congressman Welch's community and communities across our country. And I think that people are energized by this progress that we're making. And they are just encouraging me to keep it up, to keep pushing, to keep working. And I'm delighted to be able to do this work on their behalf.
Yeah, I agree with Lauren. I mean, the process is messy, but we should never complain that the job is hard. It's the job we have, and we've got to do the best we can. And everyday people, they face the same challenges. Each day you get up and face the problems before you. You don't quite know how you're going to fix it. You don't know when you're going to get the cooperation and collaboration you need, but the only chance you have is to keep at it. And I think at the end of the day, a lot of my Republican colleagues were shocked to find out that Joe Manchin's a Democrat. And so we're glad to have this done. But you know what? Effectiveness is really essential for us to embrace as Democrats. We've got a broad coalition with lots of different people, lots of different emphasis. But at the end of the day, there has been an orientation about doing things to provide economic opportunity for everyday people. And the things that we have in this legislation, like lowering prescription drug costs, like the premium affordability, just to mention two, they are really beneficial whether you voted for Trump or you voted for Biden. We can have a big fight about it all, but the things that the Democrats are united around are broadly beneficial. A safer intersection is good for everyone. Affordable premiums, good for everyone. Lower insulin cost is good for everyone. And we've got to keep focused on the fact that we want to have policies that are going to be good for everyone. It's not about just bragging that we did it and they didn't. I mean, it is a fact that it was all Democratic votes, and there's a fight for failure led by folks like Mitch McConnell. And what his, he understands is if there is failure, we get to blame, even though he was the cause of it. But the success that we have here, I think, is a real reminder for Democrats about the value of getting to yes within our caucus, and hopefully with some Republicans as we go forward. Thank you.
Thank you. I think, Michael, too, the voters will have a chance to make their voice heard over the next several months too. And Congresswoman Underwood said there's a stark choice between those who deliver and stand up for working people and those who are taking the side of the big moneyed interests in this. And so I think this is an issue that will penetrate because it affects everyone's daily lives in such a meaningful way. I want to thank everybody who joined us on the call, to both Congress men and women, to Carissa, who I should have let answer Rachel's question, because I think she said it at the end of her statement when she said, I can't afford to go back to the way health insurance used to be priced. And that would have had immediate effect on her family. But once again, thanks to everyone. We look forward to Friday's vote. And then we look forward to the American people benefiting from all your hard work. Thank you.